Hey everybody, welcome to our CHAMP series, our classes to help and motivate parents. We're going to be talking about an introduction to ABA services today, but before we get started, I just wanted to remind everybody that this presentation in no way seeks to diagnose or treat illness or to replace medical care. Be sure to see your physician if you have any health problems. If you're experiencing a medical emergency, of course, call 911 or go directly to your nearest emergency department. I also wanted to remind everybody that this presentation is being recorded and Hamilton and their affiliates may replay this presentation on an ongoing basis for promotional or educational purposes. If you disclose protected health information, it may no longer be protected by federal privacy regulations. So if you have any specific questions for yourself or for one of your children, you are more than welcome to email me at lcoker@hhcs.org, or you can contact us here at Anna Shaw. So I'm happy to introduce Kelsey Nelson, our board certified behavioral analyst, our BCBA here at Anna Shaw, and she's going to be talking about introduction to ABA.
Hi everyone, as Lindsay said, I'm Kelsey Nelson. I'm the lead board certified behavior analyst here at Anna Shaw. And I'm just going to give you a little introduction to ABA therapy. ABA stands for Applied Behavior Analysis. I have a little presentation that I came up with. Cameron Stewart and Daniel Oliver are RBTs, which is Registered Behavior Technicians, also assisted with this presentation. Okay. So first off, who does ABA therapy? You can have a BCBA is always going to be supervising. So they may not always be directly servicing, completing the hours or working with your kiddo, but they should always have a hand at some point in your child's plan and overseeing what the RBTs and everything is doing. BCBAs can have a master, or they have to have at least a master's. They can also have a doctorate. And you complete a verified coursework or a ABAI accredited graduate program. You have to do so many field work with supervision under a BCBA, and then you have to pass the certification board, and that renews every 2 years. Underneath the BCBA, you can have a BCABA, which is an assistant. They all the same things, except they can have a bachelor's. Except 1% of their hours still have to be supervised by a BCBA even after they're certified. And then a registered behavior technician, all they have to have is a high school diploma. They have to complete a 40-hour training course. They have to do a competency test that a BCBA signs off of each year. And then they have an exam they have to pass, and then 5% of their monthly hours have to be supervised by that BCBA that is supervising them. So currently ours are Cameron and Daniel, but they both actually have their bachelor's as well. So that's awesome. So what is ABA? So Applied Behavior Analysis is a science devoted to understanding and improving behaviors. We focus usually on socially significant behaviors. So it's a scientific approach for discovering environmental variables that reliably influence socially significant behaviors, and for developing a technology of behavior change that takes practical advantages of those discoveries. So we look at things in the environment and things that we can change to change the way the behavior is. It's an evidence-based treatment. Several of the defining characteristics, first is applied. So we're wanting to improve people's lives. It's behavioral. The behavior in need of improvement should be measurable, and making sure it's the kiddos, in this instance, behavior who's changed and not the people around them. Analytic, there's a functional relationship is shown. We take data to show that. Technological, it's detailed and clear, and it can be replicated. So something I do can be replicated by the RBTs or vice versa. Conceptually systematic, it must relate back to the principles of behavior. Effective, is there actually improvement? If we're not seeing any changes, then we have to change tactics and try to find a different way around it. Generality, does it happen? Can you change things over time, environments, people, behaviors? If it's just working for us, it's not going to be very helpful for parents. So it's something we want to be able to generalize out to other people. So we look at the relationship between the environment, the behavior, and the consequence. So the central idea is that the majority of behaviors are learned. The behavior is a result of certain conditions in the environment. And it's not necessarily that people are purposely teaching these maladaptive behaviors. It's just they kind of get reinforced, and sometimes you don't even realize you're doing it. So the antecedent is the person, place, or thing. It's the event right before the behavior. It's usually called the trigger. Behavior is any action that can be observed, counted, or timed. It's important that teachers, parents, and clinicians are clear and detailed about what behaviors are happening. Sometimes aggressive and disruptive are not specific enough. May need to go into more of an in-depth definition of it, but also if you have a kiddo that's like has a bunch of different behaviors as far as aggressive, it's going to be too hard to count. Kicking, pulling hair, scratching, pinching. So sometimes those will be lumped in together. It kind of just varies kiddo to kiddo. ABA is very individualized. Consequence is the event that comes after the behavior. So the consequence is typically what is maintaining or making it likely to occur over time. So that leads us into the functions of behavior. So we typically try to find the functional relationship between the antecedent behavior and consequence. Oftentimes, these maladaptive behaviors do serve as a means of communication. So when a child can't verbally communicate what they want, they will resort to some other means to communicate their needs and wants. So common functions are attention, escape, access to tangible, and then automatic, which is also just like a sensory thing. They just like how it feels on like a biological level. Access to tangible would be like you take something away, so they start engaging in a behavior to get that item back. Escape is like you remove something they wouldn't necessarily want to do, like say homework or something, because they started pitching a fit. Attention is they scream, you give them attention, whether it's good or bad. It's those are some of the common functions. Behaviors will often have more than one function, and that function could change over time. And the behavior could look the same for all of them. So a child could kick to get attention, could also kick to escape a task. So it's important to understand the function behind a behavior so the correct intervention can be used. For example, if you have a child that is talking and throwing objects to escape doing work, so the teacher removes them from the room, then these disruptive behaviors will likely occur again at some point because they're getting what they want. They don't want to do their work. They're getting removed. So more than likely in the future, this will occur again. Same behaviors in response. So they're talking, throwing objects, but they're doing things to gain access to attention, and they're removed from the room. The behavior likely won't be repeated again because they're not accessing the attention that they wanted initially. So some ways to find out the functions of these behaviors is collecting ABC data. So it can sometimes help determine that functional relationship that you may not see otherwise. You may not see it if you're just thinking about it, but if you write it down, you may be like, oh, this happened. This seems to happen pretty consistently. And then some variables that should also be taken into account are time, setting, people, activity, and just the date. Certain times of day are harder for some kids. Certain people have difficulties with some kiddos. They might have trouble at home, but not so much at school. It's just going to be all over. So this is kind of what an ABC data collection form will kind of look like. It's helpful for clinic-based ABA to see some of the things that might happen at home. So it's helpful. So we don't necessarily see what you guys will see at home. So it's nice to have something that tells us what is happening. It's also, I know, probably difficult to, in the middle of a tantrum or even the end of a tantrum, to think about having to write all this down. So sometimes it's not, you just forget, and so it's not always done when it should be, because it needs to be as fresh as possible. And this isn't usually how we track behaviors, unless it's something new that we're seeing and we just want to see how often it occurs and things. It's usually frequency and or time or something like that. But for clinic-based, sending things in home, ABC data is sometimes helpful. Some things that we use to help change that behavior is reinforcement. So the change in the environment immediately following a behavior that increases the behavior in the future. So positive reinforcement, something that is presented immediately after a behavior that causes the behavior to happen more frequently in the future. And negative reinforcement is something is removed immediately after a behavior that causes that behavior to happen more frequently in the future. So positive reinforcement would say you're trying to you're trying to potty train. And so every time they pee in the potty, you give them an M&M. If they really like M&Ms, that's more likely to happen in the future. Same thing with like negative reinforcement. If this would be like removing, they scream, you take away the marker because they didn't want to write with the marker. They're more than likely going to scream in the future to get the marker taken away. Non-contingent reinforcement, it's a procedure used where reinforcement is given after a specific amount of time, regardless of the behavior. And this is often used to decrease maladaptive behaviors as well. So instead of waiting for the behavior to occur and intervening, if it happens a lot, sometimes it'll be like a time-based schedule of, okay, if they can go 5 seconds without spitting, then they can have an M&M or something like that. Extinction, it's when you're no longer reinforcing a previously reinforced behavior. It's called an extinction burst. The behavior will get worse before it gets better. And that's usually the tricky part that comes in, is because sometimes parents will see that behavior getting worse, and so they'll think it's not working and they'll immediately stop. But if they keep going a little bit longer, you would probably see that decrease. We have 2 different kinds of reinforcement. You have continuous, it's where each and every time a behavior occurs, it's reinforced. So when you're potty training, it's best to do continuous reinforcement, where every time they pee in the potty, you give them an M&M. And then once they are consistently going, you can kind of move to an intermittent reinforcement schedule for a while for some, but not all instances of behavioral reinforce. So you don't have to reinforce every time they go to the potty, but maybe every 5th time, things like that. There's also punishment. You change an environment immediately following a behavior that decreases the behavior in the future. Positive punishment is something that is presented immediately after a behavior that causes the behavior to happen less frequently in the future. That would be like a spanking. We do not use that at Anna Shaw, obviously. Negative punishment is something that is removed immediately after a behavior that causes the behavior to happen less frequently in the future. This would be like removing your child's phone and grounding them after, and then that behavior decreasing after they did some, say they were yelling at you, so you took their phone away. If they're really reinforced by their phone, more than likely that behavior will decrease. And so that was a negative punishment. You always try to use some kind of reinforcement intervention first. We obviously would never use positive punishment here, but we always try to use some kind of reinforcement schedule before we even try to use some kind of removal of something like negative punishment. A typical session, and they will vary drastically from kid to kid. Typically ours, they start off, we come into the room, they start off with X amount of time, usually 2 to 3 minutes. When the timer goes off, they come to the table. We complete so many number of tasks. They get high praise and reinforcement for independent and correct responding, and you get lower praise and less time for more prompt dependent kind of things. Then they get a break and it just switches back and forth like that. The first few sessions of ABA will usually look more like play, where it's just them building their relationship, the therapist and the child, to where the child will want to come to therapy. And then like kids that don't have attending skills, we won't necessarily make them come to the table yet. We'll take the task to them. And then usually it's just like starts out like one task, and we're really just looking for some form of compliance, and then we'll praise and immediately reinforce. And like some kids who just are super non-compliant, they don't want to do anything that you ask them. If they just do it, even if you have to physically prompt them like hand over hand, and they do it without any kind of crying or anything, usually that is high praise and they get reinforced so that we can work towards them doing it independently. And then we slowly start adding in those attending skills of sitting at the table and things like that. So these are some things you can do at home for a tantrum. So for some do's, if it's like attention, so move as much as you can away from the child, like any reinforcement, even if they have a toy in their hand and they're kind of throwing a fit, try to remove the toy, but ignore the tantrum as much as you can. Obviously make sure they're safe. Occasionally tell the child that in order to have so-and-so, that the child needs to have a calm mouth and body, but try no eye contact. So say if you're in the kitchen on the phone, and they start screaming because they want you to come play with them, you could say, when you have quiet mouth or a nice mouth, then you can ask me to come play. Things like that. It's in teaching that appropriate way to get attention, because they are still learning. They don't know the appropriate way to get attention. So they will need to be taught that replacement behavior. We can't just expect them to know what to do in order to get attention. So they will need to be taught. Don't give attention to the tantrum. So don't feed into it. You don't run into them and like coddle them and hold them and things like that. Don't try not to comply with the demands of the child. So don't give them what they want, especially if they're throwing a fit while they're asking. At least make them ask in a more appropriate way, and don't bribe the child. So not a, hey, if you stop, I'll give you this sucker kind of thing. And then like, how do you know if it's attention? So are you talking on the phone? Are you busy with another kid? Are you not doing something that is around them and they realize that you're not playing with them or around them? Then it's probably attention. So what if you ask them to do something and it led to a tantrum? And there are a couple of different ways to handle this, and it will all depend on what works best for you and your child. The end result will always end with you following through with the original task. How you get to that point will be varying. Some kids, it works better to do some kind of compliance drill. So it's just like master task of touch your nose, touch your head, touch your shoulders, just over and over until they're doing what you're asking, and then you can go back to the original task and ask them. You can wait it out. So if they're throwing a tantrum because they don't want to pick up a book or something, you can just wait it out, let them throw their tantrum, obviously make sure they're safe again, and kind of you can put them like in a little corner and let them throw it. And then you can even say, like, every once in a while, be like, oh, when you get a big boy voice or a big girl voice, you can pick up your book and then we can go do something else. But whatever it is, the original task needs to be completed before they move on. And escape would be, it's different than if they're frustrated because they can't do a task. If they physically can't do it, I think you'd probably know your child well enough to know if it's a frustration thing or if it's more of a they just don't want to do it. Usually frustration will require more of a physical prompting where they need help doing it. So that will be more of you have to help them complete that task. So some things to make sure not to do is take away the task or take them out of the area where the work is. So either way, they're kind of escaping that task. So more than likely that behavior will continue in the future. Things to remember during tantrums, which I know is so hard when you're in the middle of it, is to stay neutral. So I know almost first instinct is to get annoyed and irritated and almost yell back, but it's stay as neutral as you can. Don't let it show on your face. Just, hey, when you get a big boy voice, we can do this. Things like that. And things like if you don't have the time or the patience for a potential tantrum, like, your kid usually throws a tantrum when you tell them to pick something up, and you're having a bad day, you don't think you have the patience for it. It happens. Just don't give the demand in the first place. It's better to just not give the demand than not to be able to follow through with that demand. And then, so say if a tantrum happens, you didn't even think it would cause a tantrum, but you don't think you can handle like a huge long tantrum, or you have to be somewhere in like 5 minutes, so you need to leave. It's better to end it sooner rather than later. So end it within the first 5 minutes as opposed to 45 minutes down the tantrum, because the next time that tantrum is going to last even longer. So if you can't ride out the complete tantrum, just end it sooner rather than later. Be consistent. These kiddos are going to need consistency. So they're going to need to know that the rules are the same every time, and not just, oh, this time it's this and this time it's this. Needs to be very consistent. Try to block any aggressive or self-injurious behaviors, but try not to comment on them. I know sometimes it's hard to be like, oh, don't do that. But sometimes that can also become attention maintained. So even if at first it starts out as escape maintained, it may become attention maintained. So you can block it. You can occasionally say, oh, we got to have nice hands with ourselves, or we have to have nice hands, but try not to comment on it as much. And catch them being good. So praise them when they're doing what they're supposed to be doing. So if they're sitting watching TV very nicely, I know it's easy to be like, oh, they're just doing what they're supposed to be doing. I don't have to worry about it. But if you have to set a timer, if they're sitting there every like 3 to 5 minutes, be like, hey, you guys are doing so great. That way they're getting that attention without having to resort to some of these other maladaptive behaviors. So one thing to keep in mind with Extinction, if you try any of this at home, but I really think you should talk to someone before you do any of this, especially if the behaviors are severe or anything like that. Extinction as a procedure occurs when reinforcement of a previously reinforced behavior is discontinued. So as a result, the frequency of that behavior decreases in the future. It will get worse before it gets better. So it's going to look like this. So it kind of, you see like, it's kind of like a lower kind of score. And then when you start putting in that intervention of whatever you were recommended, it's going to go up. And depending on how well it's kind of engaged in or whatever, it may go up even more and before it goes down. So you just have to make sure you stick to it. And that's kind of one of the big issues with Extinction is that, but then we also, I try to teach like a replacement behavior. So we're not just extinguishing something without teaching some kind of replacement. So it's best to kind of do it under the guidance of some kind of BCBA. Some ABA common interventions and terms. We have preferred items. There's items that a client may like, but it won't necessarily something they will work for. So they like to play with it. But if I try to be like, oh, let's do 3 tasks and then you can have Mr. Potato Head, and they don't like Mr. Potato Head that much. So they like it, but just not enough. A replacement behavior, a behavior that serves the same purpose as that problem behavior. It's a more functional way to be taught to gain access to something. So instead of screaming and yelling, being taught to ask or tap someone on the shoulder, things like that. Shaping, so most of the time if you're learning new behaviors, we'll start out approximating a behavior. So it happens a lot with a lot of motor imitation. A kid won't fully clap, but they might just bring their hands up to here. That will be reinforced to begin with until we get fully to the full clap. Chaining is breaking behaviors into smaller tasks and teaching each task individually. So things like washing hands, brushing your teeth, making the bed, breaking it into pieces so it's not so much at one time. We have incidental teaching, which is something a lot of ABA therapy will use. It's using a child's interest to provide teaching opportunities in their natural environment. So this will happen a lot with kids who don't really have a lot of attention skills. So we'll kind of see what they go to and try to come up with tasks off of that. Prop dependent relies on assistance with a task instead of trying to complete it independently. So instead of trying for them to do it by themselves, they'll just act like they can't do it from the get-go. So that's something we always have to look out for. Persevative behavior is repeating the same thing over and over. It's kind of echolalic in a sense. Scrolling is several linked responses are given at one time. So if you're teaching like motor imitation, I know it happens a lot. So it might be clap your hand and touch your head and pat your belly. So a kid will, when you do touch your head, they'll do all 3 of them instead of just the one. So satiation is a reinforcer that's used too much and the client no longer works for it. So it's no longer reinforcing. So it's usually why we prefer parents not to buy something that a child finds reinforcing during sessions. So if your child really works for something and they really like it, we usually prefer you not go out and buy it just because it makes it harder when they get tired of it during session for them to work for it. We'll have sometimes learning tasks. We'll use a lot of full physical, which is just hand over hand. We'll gently take their hand to complete the task. A partial prompt could be kind of tapping the elbow to get them to clap their hands. Errorless teaching is ensures a correct response is always given. So instead of, if you laid out 3 cards, instead of giving them a chance to give the wrong answer, you would say, show me cat, while pointing to the cat. So they could get that from the start. They could get the correct answer. Error correction is doing like a teaching trial. So if they got it incorrect, you would then mix it up and then do it again and correct the incorrect choice. Blocking is physically preventing a behavior from occurring. Planned ignoring is deliberately not providing attention for that specific behavior. So that would be like the tantrum and the crying and for attention. Behavioral momentum is kind of using the easy task to make a hard task kind of just happen without the kiddo realizing that that's what they're doing. So sometimes if you get something, if you do something really quickly, if you do it easy, and then you do the last thing they're usually not expecting, they'll sometimes do it without even thinking about it. The pre-mark principle is like the first then, which is used quite often. So first we wash our hands, then we watch TV, things like that. That'll help out a lot. Just knowing what happens next and having just like a visual little board of this is what's going to happen is oftentimes helpful to prevent those tantrums in the first place. Redirection is so distraction basically. So just trying to get their attention on something else so they don't start a tantrum over something else. And just some references that I used. And that is all.